Testing, 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 testing.
Madam, we'll call this meeting to order, Madam Clerk. Can we get started with the Chamber Emergency Evacuation announcement?
Upon activation of the emergency alarm signal, all persons should immediately exit the building. Please use the exits to the left or right front of the council chamber or the eastern stairwell outside the rear doors of the chamber. Do not use elevators or escalators. After exiting the building, proceed down 9th Street and into the assembly area located in the former public safety building parking lot. Able persons should assist visually and hearing impaired visitors while exiting the building. Public speaker guidelines. Individuals wishing to speak during public hearings in the public comment period are generally allowed 3 minutes to speak. Persons appearing before the committee are not allowed to campaign for public office, promote private business ventures, use language of a personal nature which insults or demeans any person, including comments directed at public officials or staff members that are not related to their official duties, or address or question staff members directly. All questions are to be directed to the committee chair. Failure to adhere to the guidelines may result in speakers forfeiting any remaining time and further disciplinary action as necessary, which can include barring from attendance at future meetings of the committee for a period of 6 months. And Madam Vice Chair, all members are in attendance today with the exception of Ms. Lynch, and you do have a quorum.
Thank you. Do we have anyone signed up for public comment?
Public comment is now open. Is there anyone present who wishes to address the committee regarding items not on today's agenda? Madam Vice Chair, seeing none and no one signed up to speak virtually before the 10 a.m. deadline, the public comment period is now closed and back to the committee.
Thank you. We can start with the presentations, and then I'll turn it over to Madam Chair.
One second, we are having a little technical difficulties. Hold on one second.
My apologies. I might have missed the moment. If I'm speaking on something that is on today's agenda, is now the time I come up and speak, or do I wait? Yes. Okay, thanks.
Hi, hello. Hello, Madam Chair, members of the committee. How are you guys doing today? Hi, my name is Jackie Hale. I'm the Early Childhood and Maternal Health Strategist in the Office of Children and Families here in the city of Richmond. I'm excited to bring to you today for the next 3 hours a deep dive into maternal health. Just kidding. For the next 10 minutes, we're going to cover the ecosystem of programs and services that are available here in the city of Richmond for families with young children. Next slide. Actually, I have the thing now. Oh, hit back one more. Okay. Got it. Thank you so much. Appreciate it. So we're going to cover the ecosystem of early childhood and maternal health programs, a timeline of how the city of Richmond has prioritized and supported early childhood throughout the years, some data and trends, as well as a couple of spotlights with the Early Childhood Trust Fund, the Children's Cabinet, which is a cross-agency body that I convene here across the city of Richmond, and in partnership with our cousins like RPS, RBHA, and the Health District, as well as opportunities moving forward. So what is the early childhood and maternal health ecosystem? This is like best practice, how do you make a slide? What we have this included for is terms and definitions, so that you can go back and reference this, and we know that there are many types of programs, many good supports and services that are available throughout this time frame of life. When we say early childhood in the Office of Children and Families, we are referring to birth through about age 8. So prenatal through those early elementary years, 90% of the brain is developed before age 5. So this is why it is so important that we provide support for families and those programs and services that work with our early childhood population. So early childhood care and education is formal learning for infants, toddlers, children under 5. Early learning experiences, any activities. This is going to be our library programs, parks and rec programs, other fun things that you do, because guess what? Babies are learning all the time, whenever they are around you. If they are playing with a TV remote, if they are sucking on your car keys, babies are learning and making sense of the world. So those early learning experiences matter across the board. Maternal health is important. How are babies being born? Home visiting and home visitors, that is a component in the mayoral action plan, so we've got a definition here for that and can reference those programs here in the city, as well as one of our programs with Department of Social Services, Healthy Families. Cheryl Smith is here with me today as well. Early intervention Part C, that is available through RBHA. So again, that provides support to young infants and toddlers with developmental delays or disabilities, and is a critical support for families and those young children. So just a few highlights of those terms and definitions here, but we can always go back and reference those later. So to jump into a little bit of the numbers, what does the setup of families with young children look like here in the city of Richmond? Well, we've got 13,000 of them, children 0 through 5. When we break that out by race and ethnicity, about 55% of those young children are Black or African American, 30% white, and about 14% Hispanic or Latino. So that's just kind of the breakout of all those 13,000 children from 0 to 5. And again, when we're thinking 0 to 5, this is not big teeth. We haven't lost a tooth yet. We're not carrying a big book bag. We're thinking toddlers, we're thinking crawlers, we're thinking sticky and wet, okay? So this is the age range that we're talking about. These are little kid strollers, right? Have you carried around a potato sack recently? These are the age of children that we're talking about. Now, what about their parents? So of children through age 5, 73% of those young children are in homes with all parents in the labor force. So that's great. That means that we've got a workforce, we've got working families. It also means that we need childcare coverage for about 10,000 kids from 0 to 5 at any given moment. We also know that a lot of our young families with young children, are living in high need areas. They're living in poverty. We have about 31% in homes with making less than 100% of the federal poverty level, and about 50% in homes making less than 200% of the federal poverty level. So again, these are high need families. Risk factors could be available, but we know they all need the right kind of support because parents are their children's first and most important teacher. Welcome to parenthood. What can emojis not do, right? So we know that when you have a child, when you have young children in your home, it is a big change in your life, and there are so many great things out there, programs, people, policies ready to support you. It's not overwhelming at all, right? This is just a snapshot of some of the programs and services, policies, funding, and settings that support families with very young children. It's a lot to make sense of for families and for us as providers. So we've broken it out a little bit differently just to show you locally, again, what types of programs are available here in the city of Richmond and what ages they serve. So Medicaid for pregnant women, right? That's coverage that makes sure we're getting access to prenatal care. And if you look at the bottom of the chart, you can see kind of what age ranges we're covering, right? So again, that begins prenatally when a mom enrolls. Famous or Medicaid can also pick up and provide health coverage for the child, so that's great. If it's a purple box, it's kind of a benefit or a coverage program. WIC, Women, Infant, and Children, through the Health District, that provides formula, food, milk, other food supports and basic supports for families with young children. And then we roll into these pink boxes. Those are parent coaching, home visiting programs. So we have our Healthy Families program at RDSS. We also have 2 other evidence-based models operated out of a local nonprofit called Family Lifeline, with CHIP, which is an evidence-based model, as well as Parents as Teachers, which is evidence-based, and Healthy Families is also an evidence-based model. So these are practitioners that are trained to go into the home. They actually visit the parents. They make it easy. They go where the parents are to help provide connection to resources, talk about developmental milestones with a child, and just ensure that parent gets that support they need if they don't have a local support system. Child care subsidy, also through DSS, is another benefit or coverage program. Child care subsidy allows child care providers to get paid for the child care slots being used by families. And then we slip into some of our other types of programs. So Part C, early intervention, that I mentioned a few minutes ago, provides that special needs support to young infants with a developmental delay. We also have early childhood exceptional education through Richmond Public Schools. And you see here we're covering from like 0 to 1 up to about through age 2 for Part C, which is where early childhood education picks up at age 3 and forward for RPS. We also have the mixed delivery and trust fund early care and education slots. That's administered by our partners Thrive, Birth to 5. And then again, we break out our early Head Start, which serves infants through age 2, and Head Start at RPS, as well as VPI, Virginia Preschool Initiative, which serves children ages 3 and 4. So this was our best way to kind of mobilize all of those different circles and supports in a way that makes sense and is easily understandable for what's available here and roughly what ages they serve. So the Office of Children and Families works together to align best practices, streamline access for families, and leverage the policy and funding across those myriad early childhood maternal health and parent support programs. We also coordinate partnerships, align best practices, and leverage policy to evaluate programming for K through 12, as well as into that workforce age. Here's a couple of highlights of how the City of Richmond has supported and prioritized early childhood throughout the years, including the Mayor's Anti-Poverty Commission, the first iteration of the Children's Cabinet back in 2018-19, the Infant and Maternal Health Task Force led by the Health District, and now in 2020, to present, the Office of Children and Families. So we've really culminated and evolved throughout the years to embed what the importance of early childhood means for the city, and currently that lives in the Office of Children and Families. So we did want to add in some maternal health data for you guys this year. Last year, we really focused on the early childhood care and education slots, so those childcare spots, those seats for kids that are in childcare or preschool settings. This year, we wanted to expand and share a little bit more about the babies that are being born. Currently in Richmond, almost 54% of our pregnancies are covered by Medicaid. So that is higher than the state average, something for us to keep an eye on. And when you break it out by race and ethnicity, you can see again, we're higher than the state average, and you can also target those initiatives differently based on the populations that you're working with. I'm not going to go through all the data, but I did want to show you what data we have that's available so that we can use that to target our specific populations and show growth and achievement very specifically in those areas. Late or no prenatal care is another thing that we want to keep an eye on to ensure that the pregnant people that we are serving that are in our city are getting access to care early on in their pregnancy. Late is defined as getting prenatal care within the 3rd trimester. That is not great. We definitely want to have that happen sooner. And again, we can break that out by race and ethnicity to disaggregate and target more specifically what we want to see and achieve. Here is a slide that shows, again, we know how our babies are being born. We also know that they need the child care. Remember, we had close to 10,000 families where all parents are in the workforce. So there's about 9,700 children from 0 to 5, right, where all parents are working. So where do they go when the parents are working? This is a current point in time count of how many young children are being served by age and in what type of setting. Child care subsidy, operated by DSS, parents can choose whichever provider they want, as long as they take subsidy. So this means parents are in a variety of places and spaces across not just Richmond, but in other areas as well. ECCE Trust Fund, that's the Child Care Trust Fund, and Mixed Delivery, both are managed by Thrive, Birth to 5. And you can see the breakout there, 49 is currently enrolled in the trust fund, 283 in Mixed Delivery, and again, serving infants up to preschoolers. Current enrollment for Early Head Start at 55. And for Head Start and VPI, 474 and 656, it's a little bit cut off, 2,211 is that total number of publicly funded slots by age. So if you remember how many kids we had under age 5 total, it was about 13,000. Publicly funded slots, 2,200. The reason we focus on those publicly funded slots is because they are also a part of a statewide quality system that indicates they are being measured and observed by a third party to ensure they're providing high quality interactions for the students that they serve. So that's why we do focus on the publicly funded slots. However, we need to be doing more. 64% of incoming kindergartners are not meeting basic benchmarks. Now, this is what is happening all 0 through 5. This is an assessment given in the fall of kindergarten. It's given across the state, and we know that we can be doing better. And so how do we put the pieces of the puzzle together, 0 through 5, to ensure that more children are coming into school ready to succeed? Quick spotlight on the trust fund. This is just a snapshot from the social media of the different providers that are part of the trust fund. Wanted to show you this to show you they are using this to market their program. They are using this to provide training to their staff. They've used it to increase wages for the staff that they hire and the staff that are supporting the young children in their spaces. So we see job fairs, we see 6-7, could not include that this year. And then also, I just love this picture of the infants and toddlers getting read to because they are building those early literacy skills. And on the children's cabinet. This is how, this is a part of my day job. I convene this group together with the City of Richmond Children's Cabinet. It's a cross-agency body. It brings together different programs across the city that serve pregnant and parenting families through age 8. It strongly aligns with the Thriving Families pillar of the map, and some successes on the right that we're happy to talk about, creating an infant and toddler-friendly visitation space at the Juvenile Detention Center for the teen parents that are there. Scaling of play connections, this is the public libraries and RBHA all the way have done a great job on this. And then also collaborative planning for events to support preschool registration with our partners at RPS and the Department of Neighborhood and Community Services. Looking forward, the Office of Children and Families looks forward to exploring the benefits and support for pregnant and parenting City of Richmond employees. We are a large employer in this region. How are we as an employer supporting the people that we employ with their child care needs? Leveraging the Children's Cabinet to implement the Mayoral Action Plan, the Thriving Families pillar, and also refining processes to maximize the impact of the trust fund. Because I'm saying child care provider, but one thing I do want to echo, these are small, women-owned minority businesses for the most part. Child care providers are a small business backbone of our region, and it's important to call out the support that they need as small businesses, as does any other workforce. So with that, I'll ask for any questions.
Thank you. I would like to know how we connect people and families into these resources. Do we advertise? Do we connect them up through, caseworkers? Like, how do we connect residents and parents to these resources?
Yep, that's a great question. And remember the slide with all the different circles on it? It's like, it's so much. We have a hard time connecting ourselves as service providers. So that's part of what the cabinet does, is bring the service providers and programs together so we can have those conversations. Are we referring families back and forth? Are we able to streamline an application for enrollment? So if they fill out an application for subsidy, we can make sure Cheryl at Healthy Families also knows about them without having the families have to fill out another whole application of some sort. So it varies by the type of program. I think we can continue to do more work socializing and using our social media to promote what's out there as far as enrolling in services. And we do a really good job with RPS to promote preschool registration, but there's still a lot of room to grow, especially for those new parents early on, to understand what's available.
Now, when it comes to publicly subsidized slots, are they all being utilized? Like, is there simply a wait list, or if we promoted more, could there be more usage?
Yep. So again, it's going to depend on the type of public subsidy you're talking about. But for the slide that I showed with the chart of all the numbers, that's current enrollment. So that is currently everybody that is enrolled by age in those publicly funded slots. Our child care subsidy program has a wait list. That one is funded at the state level through federal funds. There's a finite source of money. We can only do what we can do, and DSS does a great job of administering that to the fullest extent. For our mixed delivery and trust fund, I think the trust fund is an area where we could see growth if there was more investment. We could see more infants and toddlers being served there as well. Mixed delivery is pretty full. And I think, again, with our, current enrollment there for the preschool programs at RPS, I want to say the last board packet I saw, we're maybe only 20 or so kids short on each one of those programs. So basically, full enrollment there for both Head Start and BPI.
So generally then it sounds like there's not a problem of not enough publicity, I mean, because we are for the almost entirely using all the resources that are available.
Correct.
Okay, one more question would be, okay, so 13,000 children, we've got about 2,000 in these slots. What can you tell me about the profile of all the other 11,000? Are they all in private things? Are they home watching TV with no one watching them? What do we know of the other 11,000?
Yeah. So I think some of them are going to be in different spaces, right? So a lot of times we can use family, friend, or neighbor care. If you will hobble it together to the best of your ability, right? Some of those providers, if they can be a licensed child care provider, but if they're not accepting public subsidy, they're not included in that number. So that is going to be probably a good chunk. Maybe some of our religious exempt preschools at a large church, you could see maybe they're serving a good number of kids, but they're not going to show up on that slide. But that's something else I can follow up on and get back to you to see if we can get any better data on that at the state or regional level that we could break down by locality.
Actually, okay, I have one more and then I'll be done. I know that we are migrating away a lot of our non-departmental grants work. How much of your office work will be through that program, and how much, the new, outside organization bidding process, and how much will be through other funding streams?
I think that is a great question, and I might defer to Dom and DCAO Popovich on that answer as well. I have been a part of the non-departmental grants in the past, and do know that we are funding several that do kind of support in this space, more in that maternal health, and some like food as nutrition spaces. But Thrive Birth to Five administers the Early Childhood Trust Fund, so that is where, kind of like the Positive Youth Development Fund, we're trying to really anchor and leverage a regional and state system that already exists. The providers know that Thrive Birth to Five does the training and professional development and the Virginia Quality system. They do that measurement. So having them be that kind of container for funding really is an efficient use of resources.
Hey, how are you?
Hi.
You got something, maybe?
Yeah.
Okay.
Good afternoon, Council, Chair Lynch, and members of Council. Just going to add, so we have the grant-making process, and we have also identified a few strategic-driven initiatives, and the Early Childhood Trust Fund is one of those strategic-driven initiatives. In addition, one of those 4 core categories is children and families, and we're utilizing our subject matter experts, like our Office of Children and Families, to co-develop some of those key goals that will be required for those grant makers.
So, quick question. Is there a plan to formalize the Children's Cabinet with the clerk's office?
I will have to get back to you on that one. Are we formalizing that one? Good question.
Good afternoon, Council. Forgot to say my name last time. Amy Popovich, DCAO for Human Services. This next iteration of the Cabinet, in partnership with Office of Children and Families, is to first launch, informally, as the Children and Families across departments and with community partners, kind of assess if we can use I'm sure you all are familiar with collective impact, the model to really set committees, set goals, set strategic structure to really ensure that success. But if after 12 to 18 months that's not effective, then our plan is to come back to say maybe we do need to formalize it in a different way.
And then just a follow-up is, which MAP goals are you working towards with this group?
So Thriving Families Pillar has a couple. So the overarching kind of goal underneath that is making sure that children arrive to kindergarten ready to succeed. So there's 2 pieces under that, which is home visiting, make sure that families who are pregnant with young children have that support in the home, right, to make it convenient, make it portable for them, and then also to help promote and enroll children in RPS and other pre-K programs. So those are 2 very specific ones. I can find my way into any goals you want, because the intersectionality of early childhood and families with young children exists. But those are the main ones that we're focusing on. And I would be remiss if I didn't call out too, I've got a couple partners from RBHA who are watching online, and Shayla Holman and Marlo Callahan from RPS are phenomenal partners who continue to work and be a member of the cabinet in support of the early childhood programs there.
Thank you.
Thank you.
All right, just two follow-ups for me, and I'm just, it's always great to see. This is a wonderful presentation. You did a fantastic job. It's always really great to see some of the data. Disheartening to see some of the outcomes that are, exist for our kiddos in Richmond, in the city. But two pieces of data that I think we've been asking for at least I've been for a number of years, is one, what's our penetration rate for child care subsidy? And when I say that, I mean out of all the eligible residents in the city of Richmond for a child care subsidy, how many of them are actually receiving it? I think it's really low, and I don't think we do a great job at really capturing and offering all of the moms and all the parents, moms and dads, who are eligible for that subsidy to make sure that they're signing up for that. We make it really cumbersome. You have to print out the paper. We frequently don't, people can't do it on the Common Help app. There's a lot of misnomer, there's a lot of misinformation even with our eligibility workers that you're not even qualified for it unless you have a job. That's not true. You can actually say, I'm looking for a job and still qualify for it. I mean, so there's just a lot of, I think, areas of improvement in our own DSS and the way that we're signing people up for those, for that subsidy. So I'd love to see like what our penetration rate is, because if it's really low, then we know. Maybe my hypothesis is pretty low. I could be totally wrong though, and my anecdotal experience could not match up to reality. I totally would accept that. The second data point is similarly, what's the penetration rate for Head Start slots? In other words, how many kids in the city of Richmond would be eligible for Head Start slots versus how many are getting them right now through RPS? I also venture to hypothesize that that number is probably askew and probably have a heck of a lot more kids that would be eligible for those slots. We apply for those slots and we dictate what the number of those slots is every year. So I'd love for us to work backwards and say, if we were to work across the entire eligible universe of kids for Head Start slots, how many would it be and why aren't we applying for that?
Absolutely.
All right, those are my two follow-up data points. Thank you so much, Jackie. You did an amazing job. And I think Emma was trying to come up for public comment and may have thought that you were speaking to a bill that was up today, but you just had general public comment. So you are more than welcome. Committee members, if you're okay with waiving the rules for a moment, if you want to come up, Miss Emma, you can feel free.
Thank you very much.
I appreciate that. Sorry for the misunderstanding. All right, so I am Emma Clark. I work for the Richmond Education Association as a community organizer, and what I wanted to come to speak to you about was the RPS budget. So as you are probably already aware, we have a $31 million hole in the RPS budget this year, and we are proposing some really, really significant cuts that have us deeply concerned. The assertion right now is that the reason for this budget hole is underfunding from the state of Virginia. I am very familiar with the underfunding problem with the state of Virginia and advocate very hard on that front, but I do not believe that is the reason we are in the position we are in today. I think we have some concerns about the way we are budgeting in RPS and the way we are spending new funding. We've made a bit of a habit of using one-time funds for recurring costs. Most notably this past year, we made the choice to use $3 million in one-time funding from historic tax credits for recurring costs. We did have $35 million in deferred maintenance needs. We could have allocated that money to those one-time costs very responsibly, but we chose not to do so. We also did hire 13 new people in central office last year. That included a press and events specialist, when we knew that the budget pressures we were going to be facing this year would put us in the position of not being able to pay people, having to remove 46 positions, eliminating summer school, cutting back our mental health and wraparound services by 30%, and other deeply concerning cuts. So I think in general, we're not doing a great job of planning ahead when we have upcoming expenses that we're very well aware of. So we are going to be reaching out to council to organize some meetings with you all to share our concerns. We know that council usually doesn't like to get involved, but we think that given the gravity of the situation, it really merits at least talking about how we got here and what we can do to solve this problem moving forward. So just wanted to let you all know to anticipate some emails, and we'll be looking to set up some meetings. Thank you for your time.
Thank you so much. All right, we'll move on with our next presentation, which is Superintendent Cameras. You would come up and join us for your update.
Good afternoon, Madam Chair. Jason Kemmer, Superintendent, Richmond Public Schools. I am happy to answer any questions about the RPS budget, since that is certainly a key topic of conversation, and I think there's a lot of misinformation that is being shared, and so I'm happy to correct the record on anything that council has questions about.
My first question is, so, obviously we all have read the news. We know kind of what the main components of some of the budget asks that are being put forward, what they are. Can you tell, if you don't know off the top of your head, that is totally okay. You can get back to us. But to restore the teacher, like if you were to do the teacher pay increases, just that portion, do we know what that breakout is? How much? What were we talking about?
So let me clarify a couple of things. We have existing collective bargaining contracts that have commitments for next fiscal year. And then we have 3 bargaining units that we are currently in negotiations for, and they do not have a contract for the following year. One of those is our licensed personnel or teachers. So the end of the teacher's existing contract is the end of this school year. So to maintain our existing commitments for the contracts that have next year already signed is $5.4 million. We don't, at this time, have a contract for next year. We're in negotiations, again, with our teachers. But you can think about it roughly like this. Every 1% is about $3 million. So, for example, if we were to give a 2% raise, we would need an additional $6 million. 3%, an additional $9 million.
And that is for the $5.4 million to maintain the existing contract. That's already built in your budget, you said, or not?
It is not.
Not built in the budget. So that's so, but you have a budget ask that's around 6. That is not inclusive. This $5.4 million is not included in the current budget ask. So that would be
Correct.
additional monies that we would, if we wanted to fund that someone would need to shake out of the couch cushion somewhere.
Correct.
Okay. That.
I want to be clear, though.
5.8.
That's right. So to maintain the commitments that are already agreed upon for next year is an additional 5.4. So almost double what the current ask of the city is. To then also have money for teacher raises next year is about $3 million per 1%. So for example, if we also wanted to have a 2% raise for teachers, that would be another $6 million that we would need on top of the 5.4 to fulfill the other commitments, on top of the 5.4 that we've already asked for.
And just so I can get a sense, because I think I know, but I don't want to, what is our base? So someone comes in with a master's or licensed teacher, what is our base salary?
With
I know
no
it's complicated 'cause
experience,
it's-
in essence, $50,000.
All right.
I do want to note, per an article in the Richmonder, RPS has the highest salaries in the region, which is in large part due to the investments that the city has made over the last years. Average salary has gone from about $50,000 to over $70,000.
And the $70,000 comes with commensurate experience,
Correct.
grad degrees, all that, okay.
Correct.
And okay, all right, go ahead. No, Councilmember Johnson, okay. So there's other buckets that have additional asks to them. Let's start with, so the virtual academy, to add virtual academy back in is, my understanding is $3 million?
Just shy of that, yes.
Okay. And the other big bucket,
So the other is there's a proposal to share the increase in the cost of health insurance. For the last 8 years, RPS has absorbed 100% of the increase in the cost of health insurance. And the proposal is to share that increase by 50% with employees, not the total cost of healthcare, just the increase, which depending upon what kind of plan you are on and how advanced you are in your career would be between roughly 10 and 20 additional dollars per paycheck.
so like $2 million.
2.8.
Okay. This is quick math I did. I want extra brownie points for that. Okay, so committee members, any other questions? And the reason why I'm asking those questions is just to really break it down in dollars and cents so that we know what is potentially before us and what is before you all. You all are voting.
So the school board will approve a budget to send to the mayor in the first week of March. We have another budget work session next Thursday. We had a budget town hall on Monday of this week, and then we'll meet on March 2nd and March 3rd. I believe I'm coming on March 2nd to present to the OD meeting. By that point, we will have clarity about what I think the school board will likely ultimately decide.
Okay. Committee members?
I only just had a clarifying off of what I just heard to make sure I understood it. So there's going to be, there's going to be a headline number that says RPS budget this year is X dollars more than last year, right? That's like often
Correct.
the number that people throw around. And when you say the current ask, are we saying there's like a kind of a baseline starting number that you all have published and it's around 6 million? Am I correct on that?
So the current budget proposal contemplates a $9 million revenue increase in total.
Okay.
Of that, about $5 million is anticipated from the city.
I see. Okay. And that budget does not include any of the stuff that Chair Lynch just asked about?
Correct.
Including...
As it currently exists.
Okay.
Though it will likely change before it gets to you.
Okay. I see. So then, yeah, so that 9 million, 5 million of which would come from us, would be for a budget that doesn't meet current agreements you've already made for some folks.
Correct.
Okay. Thank you.
Hi.
Hi.
I was not anticipating you speaking on this today. I'd like to have some numbers to see what we're comparing, so I'll be on the lookout for the comeback on. All these numbers right now is like what is actually happening.
Sure. I'm happy to meet with any council member at your convenience. Sure.
Councilmember Gibson.
Thank you. Good to see you.
Good to see you.
I really appreciate the district's effort to lobby for additional funding at the state. Really critical that we do that. The schools have been underfunded for far too long. And I recognize that the state funding is measured, the amount that we get. Obviously, it's a measurement of the standards of quality, and then they apply the standards of quality to average daily membership. And I recall a lot of interest and focus on average daily membership. I took note that average daily membership went down substantially in this school year. Looking at the chart, it appears about 1,000 students. And I can imagine that has hit the district pretty hard, financially in terms of the corresponding drop or state funding we're not receiving due to that drop in average daily membership. Can you talk about how the district was able to absorb the impact of that cut in state funding, and then also what what drove that drop in average daily membership?
So first, just for the public, since I know you know this, council member, average daily membership and our enrollment are two different numbers. Our enrollment is counted and reported to the state every fall. Our enrollment has increased from last year to this year. Average daily membership is a reflection of how long a student is enrolled for the year, and then all of that added up. So for example, if a student enrolls in the fall and then moves to North Carolina in December, they're counted as 0.5 in essence in our average daily membership. They're counted as 1 in our enrollment. And so the drop in average daily membership is largely due to the transiency of our student population. I can't say for certain why a particular student left. That's not information that's reported to us, but it is not atypical for school systems with high levels of transiency to see fluctuations up and down of average daily membership. There's also been concern with the recent activity of the federal government, which I think has affected families and their choices to stay or go. That has become more acute lately, but it was a latent concern even back a year ago. And so we know that several families, again, we don't know the precise number, have chosen to leave Richmond, Virginia, the United States in some cases, because of fear of deportation. So just important to clarify the difference between those two. As for absorbing that, we do the very best we can from year to year to manage those fluctuations. Again, it's rare that the number stays exactly flat, so we try not to make big swings in programming in an effort to kind of ride out the ADM wave, as it were, as best as we can. Again, particularly given that our membership was up, if we saw our membership was down, that would be more concerning and we'd have to look at contracting more, but given that our membership was up, we're trying the best that we can to maintain the level of programming that we have.
Thank you. So you, have you, the drop in daily membership, do you have the data that shows which schools, the demographic of students that have been most interacted? It does seem, I've seen the fluctuation, obviously, but, I will say that the drop is more notable last year than we had seen in my tenure in the district. And so, and it's a lot of money to absorb, and so I do think it's important to dig into that. And I'm curious, if we are seeing it in schools where there is a higher population of, immigrant students, that, what is the response? And I've seen in other school districts elsewhere in the country, Minnesota, et cetera, where they're looking to expand their virtual programs in order to meet the need of the moment. And so I appreciated a lot of teacher comment that I've heard expressing concern about closing the virtual school. And to that end, I wonder if we were to close, or the district were to close its virtual program, have you surveyed families to find out if they would indeed stay in the school district? Because I have some concern that by ending that program, we might be causing further erosion to the average daily membership that we currently have.
So we don't know just yet, since we just announced the proposal, but we have begun a process of meeting with each family to understand what their plans are, whether it's to return to their zone school to participate in open enrollment, and we've extended the window for them. It might be to participate in the state's virtual program. So we're exploring that now, and we'll know over the next couple of months what families ultimately decide to do.
Thank you.
I will note, to my knowledge, we have not yet had a family, an immigrant family, who wanted to go to the virtual academy because of those fears. That may become an increasing issue, but to date, I am not aware of any.
Thank you. I also understand this year, in prior budgets, based on my experience, it was the practice of the school district or the administration to disclose the details about specific job cuts in our budget. I push for advocacy and transparency, and so that detail was included in the presentations that received from the administration. And I remember in specific one year, there was a manager position that was a central office position that was in discussion for being eliminated in the budget, and the community really came and advocated on behalf of that specific job, and we ended up keeping the job. And so in this budget, in the discourse that those jobs have not been promoted or published, and I'm wondering why that changed this year.
So first, I want to note that anyone whose job is slated for reduction is, of course, free to share that information publicly. Ultimately, in conversations with the school board, the decision was that it would not be appropriate to share that personnel information. I'm happy to follow the guidance of the board as they so decide.
So I understand that the district has also published a couple of revisions to its initial budget. Like there were errors in the budget that was published the first time, and that also had not been something that had happened before. Seems unique. Can you speak to the corrections that had to be made to the budget?
Yes, there was one error. A set of individuals were miscoded to a particular line that was corrected and it was republished. A second change was not an error. We simply included in the budget exactly where all the reductions were taking place so that they showed up in the FTE count. It was just a change in decision of what the board wanted to see, and so we made that correction and then re-uploaded that.
Thank you. And one last thought, and so, given the lack of transparency as it is regarding the positions that have been eliminated and the corrections that have had to be made, there's no way for the public to really be able to reconcile the budget that it's been discussed and what's actually there. I'm wondering, in lieu of or considering the errors, if you would be open to calls to have the budget audited by a third party.
So again, you have used the term error in the plural. There was one, to my knowledge, that was corrected once it was pointed out. Again, I'm happy to do as the school board directs me to do, and if they wish to publicly release the names of all 46 and their positions, I will do so. That just has not been the position of the board at this time. And as I believe you know, council member, we do get audited every single year by an independent accounting firm. That audit is publicly available on board docs for anybody to see.
And just one final point of clarification. So the audit that's done, that's regarding the overall finances and the financial health of the district, but is not specific to the budget, which is where my question was. But
It's comprehensive. It covers the entire school system, all of its finances, including the budget.
and so, but also as it pertains to the disclosure, that we're now in a budget process, right? So we're talking about, how we're allocating funding. And I appreciate that there are true stakes for the public in the decisions that we make in the budget. And each position is not created equally, right? I mean, we talk about 40, 50, however, central office positions. And when we talk about central office, the reality is that they might report to someone in central office, but oftentimes there's school-based positions that could be cut. And so as such, the public has interest to know what those were. You noted that the school board could release the names of the people, I think you were saying, and their titles. And I'm wondering why the names of the people would have anything to do with it when we're talking about making decisions about the budget.
I'm saying they could release the names, the positions, only the positions, whatever their directive is. By releasing the titles, in most cases, it would be tantamount to releasing the names because there's only one person in that title, and so there wouldn't be much difference. And again, out of respect for the privacy of those individuals, that just hasn't been the decision at this point.
Thank you.
Go ahead, Councilmember Jones.
I'm sorry, I did have one question. You brought it up. You talked about the average daily rate to the enrollment. So from 24 to 25, there was a drop within Black students and economically disadvantaged students. And so how did you account for that within the budget? Because that was just the most recent data that did come out that showed that there was a drop in from 24 to 25, it was 12,000 and it dropped down to 11,000. And then it was in economically disadvantaged, it was 14,000 and it dropped down to 13,000. So how is that accounted for in the budget and how are you?
Yeah, that's mostly impacts the state funding allocation because there are some funding streams like the at-risk add-on that are tied to things like the percentage of economically disadvantaged students, and so that has an impact there. I will say RPS tends to reflect changes in the city, and so as the demographics of the city continue to shift, I think we should expect to see that also in RPS, and so that is something we will all need to confront and grapple with over the coming years.
Correct. So you have seen a decrease in funding from the state because of that?
Based on the parts of the state funding that are tied to those kinds of things, yes.
And then the last question, on the flip side of that, when I think you were here last time, you noted that graduation rates were up, and they were specifically up in economically disadvantaged students and Black students. So how is, it's kind of like if we losing students, but then we're saying that the graduation rates are up, how are we kind of contrasting that? And I don't know, so that's why I'm asking you.
Sure. Yes, the rates for both of those were up. Not only were they up, but they were the highest in 20 years. That's as far back as we have data from the Virginia Department of Education. I think they're up because our teachers have been doing extraordinary work and we've been investing in those student populations and putting a lot, particularly around graduation. Yes, with declining funding, it potentially puts some of those supports in jeopardy, and so it's something that we're watching closely to make sure that we don't lose any ground on those very important subgroups.
Okay.
Thank you.
Well, I would suspect that we have a lot more discussion on all these items. Just doing some quick math in my head, it sounds like in addition to the 5.8 or 5.6 million that you've requested from the mayor that we may have an additional almost 13 million that if we want to restore all these items?
If we wanted to restore the items that were listed, yes, it would be about 13, maybe a little bit more. But of course, I ultimately defer to the school board on that decision.
Okay. Well, more to come. Any other questions, committee members? Go ahead.
Yes, if I may. I was wondering if you could speak to the impact of the ice storm on RPS and yeah, and like, there's probably a lot to say, but in the short time that we have, if you wanted to express how it impacted RPS and how it went.
I officially am anti-ice in all of its versions. Look, it was a huge impact. We lost 7.5 instructional days of in-person instruction. During that time, our secondary students spent about a week in asynchronous instruction, and then the last couple of days in synchronous instruction to the best of our teachers' abilities at the elementary level. It was initially paper packets, and then we switched over to electronic ones via Parent Square, given the length of the closure. I do want to shout out our very dedicated and hardworking teachers who did their very best to keep our students engaged, but as we learned during the pandemic, there is no substitute for in-person instruction. And so despite our very best efforts, we certainly did lose some momentum, which is why I proposed to the board to increase some of our instructional days, which is why we have turned next Tuesday into an in-person learning day, and the Monday after Easter, April 6th, also into an in-person learning day. And I hope and pray for no more precipitation.
Ditto. All right, well, thank you so much, Superintendent Cameras. We appreciate it. And now for a brief update from our DCAO, Amy Popovich, if you would come join us. Thank you.
Good afternoon, Chair Lynch, Member of Council, DCAO Amy Popovich. I'm going to make those adjustments on my calendar for RPS right now. I have 2 updates for you all today, continuing the theme on funding formula and also on our emergency shelter and extreme weather warming centers. This is an update on behalf of the CAO on the development of a funding formula for Richmond Public Schools. The administration recognizes the importance of this initiative and remains committed to the work collaboratively with RPS and with the school board to develop a predictable and objective funding methodology. We've begun preliminary research and internal discussions to ensure that when we formally convene this work group, it's focused on building a framework that supports both excellent public education and essential city services. The discussions to date, including the public conversations, have underscored the value of sharing understanding of both entities' fiscal constraints and opportunities, the importance of multi-year planning horizons, and the need to consider how any funding formula might interact with state and federal resources. We have not yet formally established the work group, but remain committed to doing so and approaching this work with the seriousness and transparency it deserves. We will provide council with a formal plan and timeline for establishment in the coming weeks. All right, the next one is about the 17 days between January 24th and February 9th. 17 days where Human Services supported shelter 24/7 continuously, along with our partners Salvation Army and Caritas. The winter storm response involved activating our Emergency Operations Center and the emergency declarations at both the state and local level. I think that you all have gotten our graphics here sent to your email about our winter shelter operations. Just briefly want to discuss them to make sure you all understand them. Salvation Army operates every day from the middle of November to the middle of April. Caritas operates when it's 40 degrees or colder for 2 hours or more, and when Salvation Army is out capacity. Our extreme weather warming centers operate if both of those entities are full and one of the National Weather Service's winter advisories is activated. So that includes winter storm, wind chill, and extreme cold. Our emergency shelter only is operated under an emergency. So here, in the 2 times we activated, had those 2 different states of emergency. While our warming centers are operated by the Department of Neighborhood and Community Services, the emergency shelter is operated by Social Services and Parks and Recreation. Let's see, our total number of nights, extreme weather warming centers averaged 43 people per night, while the emergency shelter averaged 62. If you add up all of the folks in all of our shelters, that was totaling between 212 and 262 nightly across all shelter operations, approximately 60 to 70 more people than we've seen in previous winters. That totaled 2,740 guest stays throughout those 17 days. We also provided 40 transportation routes within those 17 days in partnership with GRTC, our Justice Services team, and Blue Sky Fund. These trips occurred between our day warming center at the main library and either the emergency shelter or the warming center. It also included trips between all of our shelter providers to ensure that no one reached capacity. To all of our knowledge, no one was ever turned away, and there was always additional capacity should the need have arisen. And there'll be additional information coming in our after action report in the weeks to come.
Thank you for that update. That is, any committee members, any questions? I know that we are due for, during our next committee, probably and after a wind down kind of review as we approach the April date, and just plans for transition, kind of feedback on what we think went well, additional areas for improvement. I know I've got, kind of my running list as well as other committee members and perhaps stakeholders. So I would propose that we probably slate that for it might be helpful to do March or May.
Yeah, if I may, the whole after action report, I believe, will be presented to the full body, and then a wrap up of all of our inclement weather season is slated for May. If I understand that right. Okay. But yes, more to come with the after action report.
Perfect. Well, thank you so much for your efforts, and I know it was a full-time 24/7, all hands on deck during the storm, so really appreciate you all being there for us and our residents. Thank you. All right, committee members, we are going to move on to papers for consideration. We're going to take, if it's okay with the committee, we'll read in the last 2 ordinances, which are both opioid settlement ordinances. We can vote for them in block, even if you want to be even more efficient. And then we'll get back to ordinance number 1. Yes, ma'am. Yep. If that pleases the committee, yep, let's go for it.
Item 2, ordinance 2026-037, to authorize the CAO on behalf of the city to accept funds in the amount of $41,240 from the Virginia Opioid Abatement Authority and to appropriate the increase to the FY26 special fund budget by increasing estimated revenues in the amount appropriated to the Department of Neighborhood and Community Services, OAA, Harm Reduction Vending Machine Special Fund by $41,240 for the purpose of providing funding for harm reduction vending machines to combat the opioid crisis. Item 3, ordinance 2026-038, to authorize the CAO on behalf of the city to accept funds in the amount of $100,000 from the Virginia Opioid Abatement Authority to amend FY26 special fund budget by creating a new special fund for the Department of Neighborhood and Community Services entitled OAA Mini Grants Special Fund and appropriating an increase by $100,000 for the purpose of providing grants to community partners to combat the opioid crisis. Those papers are before the committee.
Madam Clerk, anyone here to speak for or in opposition of these papers?
Is there anyone in the chamber who wishes to speak in opposition to these papers? Is there anyone who wishes to speak in support of these papers? Madam Chair, seeing none, the public hearing is now closed and back to the committee.
Committee members?
I'd just like a little bit of detail on exactly how quickly these funds will be spent and what outcomes we expect.
Good afternoon, members of council. I'm Anna Jones, opioid response strategist for the city of Richmond. Your first question was how quickly will these funds be dispersed to the city from the Opioid Abatement Authority?
And then when do they need to be spent?
When will they be spent is the other question. Yeah, so after the, if this legislation is to be adopted, the acceptance of the funds will then be forwarded to the CAO's office for signature. Once that happens, we can submit that to the Virginia Opioid Abatement Authority, and then roughly 7 to 10 days from then, we would receive the funds. There's a different answer for both of these projects. For the $100,000 in mini grants, we currently have an open request for applications that will close March 20th. So at that point, that'll give us 1 month in our review group to select applicants. And at that point, then we would be back before City Council to seek approval to enter into grant agreements with the chosen community partners. So I'd anticipate that would be about May or June of this year. For the harm reduction vending machines, a similar process on receiving funds from the Virginia Opioid Abatement Authority. And as far as how quickly we would expend those funds, I would imagine that we would expend a good portion of those funds pretty quickly after receiving them from the Virginia Opioid Abatement Authority. We're in the process of identifying locations for these 3 additional vending machines right now. We use a litany of public health data and also input from our community partners. We look at fatal and non-fatal overdose rates, and also the data that we've collected from our existing harm reduction vending machines. And some of that has to do with the logistics of how these operate, right? We need a space that has external power for the vending machine to plug into, in a place where it can be monitored and maintenance, and also where residents are able to have 24-hour access to this. So before, we've used libraries. Right now, we're considering, strongly considering 3 libraries for placement of these machines, but in certain cases, there has to be a concrete slab poured, or the outside facade has to be amenable to having a machine. So some of the delays depend on how quickly we can make it through these logistical challenges. But we will move as quickly as possible to get those placed.
All right, I was wondering my impression is that most of these projects are funded by the opioid settlement funds, but what types of city funds, if any, are also being spent on to get these projects done?
So at this point, there'll be no fiscal impact to the city at all. The projects will be completely covered by funds from the Opioid Abatement Authority.
Thank you.
Yes.
Motion, sorry. Motion to forward to council for approval.
Madam Clerk, call the roll.
Can I get a second, please? The committee is voting on the motion to forward item 2, ordinance 2026-3037, and item 3, ordinance 2026-038 to council with a recommendation to approve. Mr. Breton?
Aye.
Vice Chair Jones?
Aye.
Chair Lynch?
Aye.
That motion has been approved.
All right, committee members, moving back to ordinance 2025-276. Madam Clerk, if you can read this paper in, we'll do public comment, and then we'll do a little table setting for what the direction for this paper.
Item 1, ordinance 2025-276 to authorize the CAO for and on behalf of the city to execute an outside agency contract between the city and the Boys and Girls Club of Metro Richmond for the purpose of funding the expansion of life skills programming at Martin Luther King Jr. Middle School. That paper is before the committee. Is there anyone in the chamber who wishes to speak in opposition to this paper? Is there anyone who wishes to speak in support of this paper? Madam Chair, seeing none, the public hearing is now closed and back to the committee.
All right. This paper was before us during our last CHS meeting. Members went back and did some research. The administration did some research. The question was about our ability to expand some of the services that Boys and Girls Club would be able to provide, and whether or not there is capacity, capability, and legal authority to do so in more than just one middle school. I believe that we did hammer that out, and I believe that the committee, if so desirous, could express its intent to make an amendment to expand those services. And if anyone from the administration wants to come up and clarify, they can, but essentially that would be my recommendation for this paper that I'm putting before the committee, is to express our intent. My understanding is we do not need to submit an actual amendment. But if, okay, go ahead. Yeah, we can bring the administration up. Go ahead.
Good afternoon. Eva Colin, Senior Policy Advisor, Office of Children and Families within the Department of Neighborhood and Community Services. So with that, we actually are deferring to legal counsel and to you all. So I'm going to pitch it to Ms. Palmer to be able to answer the legality of the amendment process.
We can do it operationally. Legally, do we need to put forward an actual text amendment, or can we, as a committee, vote for the paper with a desire to expand the contract beyond MLK?
Based on the budget for the outside agencies and the general fund budget amendments, the monies can go to schools outside of MLK. However, it would require that the ordinance either be amended or withdrawn, and another ordinance drafted and introduced.
Go ahead. Well, being that we do not have a text amendment, I see perplexed faces.
Madam
Mr.
Chair, Will Perkins, staff for the committee. I will take my attempt to answer the question. So as I understand it, again, the ordinance is before you. If you would choose to amend where the funds are to be allocated, I believe you may verbalize that at this time and make a motion to approve with an amendment. If you have a specific change in mind, you can say that now, and we will follow up with Ms. Palmer on drafting, converting what you say today into a text amendment to be introduced at the next council meeting, Monday, February 23rd.
Well, I think I can understand the motivation behind this possible amendment is to disperse the funds, more broadly across more students, and that, I can see the benefit of that. I would want to make sure that we could get some feedback from folks with expertise about whether that might put the actual program itself in jeopardy, because the amendment might delay the approval, and that it might delay the funding, and it might leave the fiscal year, and if that would be a problem. And then the second part of that problem might be whether or not it would no longer match what the RFP said, and if that would also create a problem.
Thank you for my questions, Mr. Brett.
And I will admit that I got those questions from Councilmember Jones.
Credit where credit is due.
Great minds think alike. Go ahead, Ms. Cohen.
Sure. I can answer the first one, and I think the second one I might ask our DCAO to lean on as well, or Ms. Palmer, because I think that kind of enters an area that's slightly outside my expertise. With the first, where we are now, given the delay due to the continuation, we're looking at the funding supporting summer programming. So regardless of what we're doing, we're looking at kind of a shift than what we were initially working with. That said, we selected the organization because we also understand that delays happen sometimes with city grant contracts. And so one of the things that they were able to identify was that this would be an enhancement of existing programming to serve additional students, but not threaten all of their operations. So this organization is operational right now, today, at both MLK and at River City Middle School, which was the school named the last meeting. They have verbalized interest in working with us regardless of how we go forward. But in terms of the RFA that was posted last summer.
Hello, members of council. From an operational standpoint, and then I'll ask our attorney here, the scope, based on what I'm hearing you all say is the desired amendment, the scope outlined in the RFA was for life skills programming. The only addition would be the change in location. So from an operation standpoint, that scope that was listed in the RFA would be the same. If you have any other attorney options.
Okay, so I'm going to make a motion. All right, so I would motion that we prepare a text amendment after the first sentence of section 1 that basically it would say, and other middle schools as deemed appropriate. That probably gives us enough flexibility in the language to allow us to move, expand locations. Or we can say explicitly River City Middle School. If you want to say that, we can do that too. But let's prepare a text amendment to be introduced alongside the paper when it goes to full committee. And we do not need to send it back to another committee. We can vote on it as is with that amendment. Correct? That's my motion.
I second.
Thank you.
So, Madam Chair, for clarity, is that a recommendation to approve with amendment?
Correct.
I still second.
Okay. The committee is voting on the motion to forward item 1, ordinance 2025-276 to council with a recommendation to approve with amendment. Mr. Breton?
Aye.
Vice Chair Jones?
Aye.
Chair Lynch?
Aye.
That motion has been approved.
All right, committee, yeah, that is wonderful. All right, with that, committee members, I believe all we have left is approval of the minutes and then our staff report from our fantastic Mr. Perkins, and I have a special announcement for him when we get to that point. Madam Clerk, approval of the minutes?
We have none for this committee meeting.
That's the first. All right. Okay, so last item is our staff report, and I just wanted to take a moment to give some very special praise and a very special loud shout out to Mr. Perkins and a warm re-welcome to Mrs. Whitney Brown, who will be taking over as the dedicated staff for EHS. You've left really, really, really big shoes to fill, and not because you have a size 13 shoe, how I know that, don't ask, but you've left an incredibly big space in your wake. You've done an incredible job staffing this committee, keeping us honest, keeping us accountable, holding space for all of our thoughts, feedback, for working with the administration. And you've done it with grace and professionalism. And I just want to say thank you for lifting this committee up and really giving us the support that these topics deserve. So really hope you don't go far. And a big warm welcome, re-welcome to you, Ms. Brown, and look forward to working with you and having you step in seamlessly for Mr. Perkins.
Thank you, Ms. Lynch. That was very kind. I did want to mention 2 action items I recorded for our friends of the Office of Children and Families, just to make sure I captured them accurately. So, Mr. Breton, I believe you asked for data, again, on the enrollment of children in non-public settings, just to assess what's available. Perhaps it's regional or state data sources, but just a bit more information on that in particular. And Ms. Lynch, you requested some data on the penetration rate for Head Start and other programs that have certain eligibility criteria, and we can follow up with OCF on how best to interpret that. Finally, I would mention your, again, we heard from Superintendent Cameras today about the budget. The full council will be hearing from Mr. Cameras at its next OD meeting, Monday, March 2nd at 4 p.m. So again, similarly, we've invited him to speak about the proposed fiscal 27 budget, so there'll be a second chance to speak with him then. The next meeting of this committee is on Thursday, March 12th at 2 p.m. We're scheduled to hear from RPS as well, but this time about their master facilities plan, which is a long-range capital plan that's in the beginning stages now. And finally, we'll hear from RHHD, the Richmond Henrico Health District, about an overview of their services, again, at that March 12th meeting. So thank you, ma'am, and welcome, Whitney. So thank you so much.
All right, with no further business, this meeting stands adjourned. Thank you all.